We'll now go to the non-statutory public hearing. So this is in regard to the pros and cons of continuing to fluoridate our community's water supply. I think that's why everybody's here tonight. Tonight's public hearing will begin with the presentations from our invited presenters who are experts in their fields. They are, speaking first is Dr. Richard Musto, MD, Medical Officer of Health from the Calgary Zone, Alberta Health Services, Clinical Associate Professor, University of Calgary. Assisting Dr. Musto is Dr. Luke Schwart. Welcome to you both.
Thank you.
And then speaking second will be Dr. James Beck, MD and a PhD, Professor Emeritus of Medical Biophysics, University of Calgary, author of The Case Against Fluoride. Dr. Beck will be speaking against fluoridation of drinking water, and assisting Dr. Beck with his presentation will be Dr. Robert C. Dixon. Dr. Beck and Dr. Musto will each have 20 to 30 minutes to provide us with their presentations. Following each presentation, council first will have an opportunity to ask brief questions of clarification of the presenters. At this time, I'd like to provide a friendly reminder to the members of council that this is not an opportunity to debate the point of view of the presenter, but simply to ask questions of clarification if there's something that one does not understand about what was said in the presentation. After the presentations of Dr. Beck and Dr. Musto, the hearing will be open to comments from those who are present this evening and wish to address council. Our Linda Turnbull has 2 lists of people, and we'll be taking for and then against and going back and forth. And of course somewhere in there, if you're undecided on it, of course at any time you can put your name on the list and just come up. If you're undecided, just wish to ask a question. It's open to everyone who comes. Somebody had mentioned, was it just residents of Okotoks? By no means. This might affect, fluoridation of the water could affect anybody in Okotoks. Could be an employee who lives elsewhere, a business owner, and so on. So by all means, anybody who wishes to speak will have up to 3 minutes at that time. And we are timing, so up to 3 minutes, and then it may go a little longer. After you're finished up to 3 minutes, you would have questions from council, once again, for clarification only. So once again, everyone, welcome. We'll start with hopefully up to approximately 20 to 25 minutes to allow 5 minutes for questioning with Dr. Richard Musto. Dr. Musto, welcome.
So again, thank you for inviting me as your Medical Officer of Health. It is one of my roles as the Medical Officer of Health in Calgary Zone to advise not only Alberta Health Services, but other decision-making groups such as yours on matters of public health. So I very much appreciate this opportunity to speak with you. And as you mentioned, Dr. Schwart, who's our dental public health officer, is here as well. So here's my outline. I expect to touch on many of the points identified in Councillor Christopher's notice of motion during the presentation, and then of course we'll welcome your questions. I should begin with making it clear that Alberta Health Services does support community water fluoridation as a simple, safe, and cost-effective means of protecting teeth from decay and helping Albertans to keep their teeth for life. This position was arrived at after what has been an ongoing review of the published literature by our dental public health staff, our science team within our environmental public health team, and our group of public health and preventive medicine specialists, the medical officers of health. So just by way of background, there is this level 0.2 milligrams per liter of natural fluoride in the Sheep River. And your community has been fluoridated since the referendum in 1980, and again reaffirmed by a sizable majority in 98. The finished water average for your water is between 0.7 and 0.9, around 0.8. So here's what we're talking about and trying to avoid: dental caries or cavities. And this child, as you can see, has multiple cavities on his baby teeth, as you can plainly see. In this view, just another view of the cavities, you can see at the at the corner of his mouth, the 6-year molars trying to come in fact, moving into the space vacated by the decayed tooth. In Alberta, as in other parts of Canada, treatment of multiple dental caries is the single most common reason for children undergoing general anesthetic at pediatric hospitals. Now, this slide is not showing the graph, unfortunately. There it is. Okay. So this is a graph that's similar to one, actually, that's in the notice of motion. It's drawn from a paper that showed the indication of caries or cavities in children over the years in a number of European countries. And you can see it's striking that, in fact, the level of dental caries is going down. And it's going down in those communities that fluoridate, those that fluoridate their water, those that have fluoridation of their salt, and other communities that rely primarily on comprehensive preventive and treatment services in their public service. I put this up to make the point that dental decay, dental caries, is a multifactorial disease. It's primarily an infectious disease, and there are many things that contribute to it, including their diet, access to dental care and preventive measures, and access to fluoride in its multiple forms. The second point is to say that the use of fluoride is not sufficient to prevent dental decay. It's important, but not sufficient. Through the course of my presentation, I'll be making reference to systematic reviews. And these are quite rigorous, well, these are rigorous and highly structured reviews of the published literature. And one feature of which is very careful examination of the quality of the studies that are being reviewed. Given the importance of avoiding harm, these reviews are purposefully biased towards including studies which suggest the possibility of harm. So you can see this on this slide. On the left-hand side concerns evidence of benefit. On the right-hand side shows studies that are examining the possibility of harms. And there are many more kinds of studies, different, in fact, levels of quality of study that are incorporated or included in the study because they're wanting to make sure that we don't miss evidence of harm. This slide is a complicated one that comes from a systematic review done in 2000 in the UK, and it shows studies from all the way back to from 1959 up to about 2000, and if you can see, make out there's a vertical line on the left, and that would be the point at which there is no benefit one way or the other, or no difference one way or the other for fluoridated water. The bars on the right favor fluoridation, and you can see the bulk of the studies, in fact, show that there's a benefit to fluoridating the water in terms of reducing dental decay. This study, this systematic review, was updated in 2007 in Australia, and they found only one other study that was of sufficient quality to include, and it reached the same, or supported this conclusion that fluoridation is an effective means of reducing dental caries. So how does fluoride prevent decay? As I mentioned, dental caries essentially is an infectious disease. There's bacteria in our mouth that break down cover the enamel of our tooth, and fluoride helps to make the enamel more resistant to the acid produced by the bacteria. It helps, in fact, to repair the enamel once it's been damaged, and it reduces the ability of the bacteria to produce acid. The action of fluoride is primarily topical, but there is also a benefit pre-eruptively when the teeth are developing that incorporates the fluoride into the enamel during the tooth formation. So it's most effective when you have topical plus water fluoridation. Here are the results of our latest round of screening conducted in the schools in the rural south. In Okotoks and High River, the only two of these communities where there were more than one elementary school, we have two results. And these were the schools in both communities where we selected those schools because they had the higher proportion of children from families with lower income. So they were the poor schools from the poorer areas of those communities, and therefore at higher risk for dental caries. You can see that there's quite a range from a low of 13% in that one school in Okotoks to a high of 40% in Cayley. And of these communities, only Okotoks is fluoridated. So with respect to safety, the conclusions are drawn from two main sources, systematic reviews, as I mentioned, and these are generally charged with reviewing evidence for both the benefits and harms. The York one in 2000 is regularly cited. Australia, as I said, updated that, and then the European Commission updated it just last year. The other reviews are, the focus is setting standards, avoiding harm, and the two that I'll make mention of are the one from Canada, Health Canada in 2010, and the National Research Council in the United States in 2006. The standard setting reviews, I should comment, they are aimed at ensuring that the most vulnerable members of our community are safe. So they're considering the unborn child, pregnant women, children, seniors with chronic conditions, and then others who, for whatever reason, drink large volumes of water, like professional football players. Now, the consensus from the systematic reviews, I'm going to quote them both for the systematic reviews and the standard setting ones verbatim, so I'm not candy coating it or massaging it for you. This is what it says. This is the European one, the most recent one. So systematic exposure to fluoride to drinking water is associated with an increased risk of dental and bone fluorosis in a dose-response manner. So the more fluoride there is, the more fluorosis there will be. There's limited evidence from epidemiological studies, the other studies, that point towards adverse health effects, and they list some of the systems. But they say that the application of the general rules of the weight of evidence approach indicates that these observations cannot be unequivocally substantiated. So we'll come back to this point. The consensus for the two standard setting reviews are, I've got the summary statements as well. So this is the one from Canada, and it says that the current maximum acceptable concentration of 1.5 milligrams per liter is unlikely to cause adverse health effects, including cancer, bone fracture, immunotoxicity, and so on. They don't mention fluorosis here because Health Canada, like some bodies, does not consider the fluorosis as a health harm. The American review, the National Research Council, said that they should reduce their maximum allowable level from 4 milligrams per liter to some unspecified level. And they said that exposure at that higher level of 4 milligrams per liter clearly puts children at risk of developing severe enamel fluorosis. And in addition, the majority of the committee concluded that this level is not likely to be protective against bone fractures. What's striking in this one is that they don't comment on on any other purported harm, because they didn't find the evidence for it. And I'll come back to this again when we talk about ethical analysis. So this is the product that is added to our water to adjust the level of fluoride to the most effective and safe level. It's a gas that's produced in the phosphate fertilizer manufacture. which when mixed with water makes this hydrofluorosilicylic acid. And when it's dissolved in water, it completely dissociates to hydrogen gas, fluoride ions, and hydrated silica, which is a natural component of water. This is the product that Okotoks uses, and as it says here, it's certified to the standards for any other products that we add to our water. This next slide is from the analysis of the water in Calgary when it was still fluoridating. And on the left are a number of the parameters that are measured. On the right-hand side are the maximum allowable concentrations by Health Canada. And in the middle are the assessed levels in Calgary. And you can see by the number of zeros that it's many, many times below the allowable concentration. In Calgary, in fact, if they measure the water out of the plant and downstream, there's no difference. So, dental fluorosis. There are several ways to measure it. The number of indexes, and that range essentially from very mild to severe. And water fluoridation at the recommended levels may indeed be associated with very mild and mild fluorosis. The moderate or more severe cases usually, in fact, are associated with children swallowing their toothpaste. Fluoridated toothpaste is 1,000 times higher than the concentration that we have in fluoridated water. So the water fluoridation level is set to protect decay and minimize the risk of fluorosis. So here's a picture of very mild to mild fluorosis. The teeth have been dried here so you can see it better, and what you're actually looking for are the kind of white lines towards the bottom of the teeth. That's what fluorosis is. If the teeth hadn't been dried, it'd be very difficult to see. The last time that we did dental survey, oral health survey in the province, we included an assessment of enamel fluorosis, and here's the results for the former Palliser Health region, which is mostly non-fluoridated, and the former Calgary Health region, which would have included Okotoks, and you can see that there's basically no difference between the two. So, what if we stop fluoridating? Typically, there is an increase in tooth decay. Unless some additional preventive program or delivery of fluoride, usually at greater cost and less comprehensive scope, is made available. And people who don't visit the dentist are the ones that are going to be most impacted. That York review that I showed a slide from earlier did look at those communities where they had information about caries levels before they discontinued and then afterwards. And again, the line on the right, the vertical line on the right, shows would be neutral, no difference. And the bars to the left show that there's in fact increased incidence of caries in those communities. So most of those studies show that there's going to be an increase. In the recent review in Quebec, they reported essentially a doubling from 8 to 17% of dental caries in the community, the city of Dorval, 2 years after they stopped fluoridating. So a reasonable question is, what alternatives are there? Indeed, there are other ways of applying fluoride to the teeth. Varnish, which we actually do provide in high-risk schools in Calgary zone. Rinses that you get at the dentist, and of course toothpaste. In some other countries, particularly in Europe, there are some other means of systemic intake through fluoridation of salt and milk. But with both of these, there's issues of accessibility and compliance. When prior to fluoridation in Calgary, when my children were little, we used drops. And in fact, the compliance rate with drops was about 16%. So there's an issue. The WHO, in their most recent review and paper on the role of fluorides in oral health, said that water fluoridation, where technically feasible and culturally acceptable, has substantial advantages, particularly for subgroups at high risk of caries. In the city of Calgary, which you know discontinued fluoridation a little over a year ago, still has not figured out what to do. The second part of their motion, just as the second part of your notice of motion, was that there should be some provision for the children at greatest risk of caries. And in spite of a lot of work in trying to figure out what to do, they have not made a decision yet. So I want to finish up with an ethical analysis, because that is often where we come down to, it's a right, who's got the right to tell me to have fluoride in my water. And it's a difficult analysis to undertake, partly because we really haven't figured out how to do that in public health yet. The standard things that we consider in biomedical ethics, autonomy, justice, beneficence, and non-maleficence, don't really work when you're talking about groups of people. It's much more difficult to figure out how to balance off the inevitable balance of benefit and potential harm. So the Nuffield Council on Bioethics in the UK, and I commend this resource to you, has tried to sort out and develop a framework for public health issues. If you Google Nuffield Council on Bioethics, you can get this report, and I encourage you to do it, because in this particular report, they consider not only fluoridation, but a number of other things of public health import that communities have to decide about: what to do about obesity, what to do about other issues of public concern. And they articulated a number of principles, and here I've listed the three that they say maybe would be used in favor of arguing for fluoridation, and three that might be arguments against fluoridation. And they proceed to, in their analysis, to discuss those. And this is what they ended up concluding, that in fact the most appropriate way of deciding whether fluoride should be added is to rely on a democratic decision-making process, just as you are undertaking here. Which means that they found there was no compelling evidence that it was unethical. I mean, their decision, if they had decided it was unethical, they said that's it. But in fact, those 6 principles, 3 on either side, as I mentioned, in their view came out as a wash, and felt that in fact it is something that local communities need to make that decision. So you're undertaking that, and I commend you for that. So in summary, the evidence is strong that community water fluoridation reduces caries. The weight of evidence favors safety, with the only consistent harm, if you will, being mild fluorosis. The wording of those other reports that I gave you were in themselves not necessarily really confidence building. They were couched in kind of scientific terms that said, left you kind of wondering, what are they really saying here? In fact, they're saying that the weight of evidence favors safety, and that judgment is echoed by myself, by Alberta Health Services, by Health Canada, by the U.S. government, and so on. It is the most efficient means of reaching all of the people who can benefit from the caries-reducing effect of fluoride. And indeed, it's important that it's your decision. And again, I commend you for undergoing this process. Thank you.
Thank you, Dr. Musto. Are there any questions of our presenter by councillors? These are questions for clarification. Councillor Sands.
Thank you, Mr. Mayor. Dr. Musto, I'm intrigued about your comment that dental caries constitutes an infectious disease. Is there transmissibility?
Well, yeah, there is actually, and mostly it'll come from the mother to the child, and there's, in fact, good evidence that where you already have multiple carriers in poor oral health, either in the mother or in the older siblings, the children, the younger children, develop it at a younger age. So again, multifactorial. There's going to be the issue of the bacteria that are the acid-producing bacteria, and then the other things that are occurring in that family in terms of diet and access to medical care.
Councillor Rocky.
Thank you. My question is in regards to the last point, being a local decision, and this is a thing that I've been having a difficult time understanding. The fluoridation of water, it really is a health issue, and Alberta Health Services, via the presentation tonight, is in favor and supportive of that practice. So I'm having a tough time understanding why it then is a local decision, why it's up to municipal councils as to whether or not to fluoridate the local water supply. Has it ever been considered that Alberta Health Services would direct one way or another across Alberta?
Well, first of all, Alberta Health Services doesn't have that authority. It would have to be the government. We're a service agency, so it would have to be the government. But this has not been something, it's not been the style of Alberta to mandate very many things in the health area. We were the last province to implement mandatory seatbelt use, bicycle helmets, and a number of other things like that. There's only been one province that has tried to mandate it, and was Quebec. And it was an unpopular decision, lots of pushback from the municipalities. So I think a government says, why would I bring that upon myself? So they look to the local group, which you're closer to the citizens, and important for citizens to have an opportunity to declare their preference.
Thank you.
For the questions, Councillor Hudson.
Yes, excuse me, Dr. Musto. I looked at your comments concerning, other means of topical application. And you talked about varnish, rinses, toothpaste. You talked about fluoridation of salt or milk. And when I go to the dentist, my dentist encourages me, being an older individual, to actually take the topical application. It leads one to wonder about the cumulative effects of having the fluoride coming from a number of different sources. And I don't know that you actually mentioned that in your review. So when you add them all up, in your experience, has there been a concern with the additive potential of the fluoride? Like most toothpastes, unless I'm wrong, come with fluoride in them.
Yeah, generally at quite high concentrations. So that's exactly the kind of question that those standard setting reviews undertook, the National Research Council and Health Canada, to try to make sure that they consider all of the potential sources of fluoride from food, from water, from these other things, and then use that to set the maximum permissible level. One of the scientists from the University of Toronto, who has been investigating fluoridation for a number of years, he's had a concern, and cited in the notice of motion, Dr. Lineback, concern about the potential for accumulation of fluoride in bone. And to his credit, he studied it and was part of a study in Quebec and Ontario where they harvested bone from orthopedic procedures, hip and knee replacements and so on, so otherwise healthy bone, and assessed the fluoride level in those bones. And there was no difference, in fact, between communities where there was fluoridated water and non-fluoridated communities. So I give him credit for disproving his initial hypothesis. That's what a scientist does. So there isn't evidence that that's an issue, the accumulation.
Further questions? Councillor Christophers.
Thank you very much, Dr. Musto. I just wanted to let you know that I have read all of the material that you sent to council, and I have a couple of questions regarding that material that wasn't addressed by your presentation. In particular, it was from, I think it was an article that it talked about, sorry, I have it right here. Water fluoridation, what does the science say?
Mm-hmm.
And at the bottom of that, there was 3 links to 3 systemic studies. In there, it says, at the very end of this entire paper, which I really appreciated, I love systemic studies, and I love knowing that an entire body of people looked at the best possible quality research and tried to make decisions based on that. And at the end of the executive summary, it says, quote unquote, it is surprising to find little high quality research has been undertaken on this topic. The research evidence is of insufficient quality to allow confident statements about other potential harms, and concludes by saying this evidence on benefits and harms needs to be considered alongside with ethical, environmental, ecological, and legal issues, all of which were beyond the scope of this study. In there, in the second paragraph, it also says the levels in water range naturally from 0.1 parts per million to over 2.4. And then in brackets it says, at which point the community must take action to reduce it. So I was wondering why a community at 2.4 naturally occurring parts per million would be required to reduce it. And do such communities exist in Alberta?
They do, actually, and that comes from, so here I've got the slide up that shows what's included in the 2 kinds of papers, but actually it's relevant. The relevant one is the standard setting one. So in the United States, their level is at 4, at which point there's supposed to be action taken, and in Canada it's 1.2. In Alberta it's 2.2, I think. So it's primarily because of the risk of higher levels of the fluorosis. So again, the review from the United States National Research Council did not find evidence for other harms at the 4 milligrams per liter level. So they're asking the government to reduce that maximal level when people should take action to below 4, because they are higher than us. And that's related to the risk of dental fluorosis. It's not related to an assessed credibility to the other studies that there's other harms.
So it's really just particular to children as their teeth are building then? There's no potential harm to any adults or anyone beyond? It's simply a cosmetic concern?
Well, I won't say it's a cosmetic concern. It's the term some people use, that's right, but it's the risk is for children while their permanent teeth are being formed.
Super, thank you. Can I have a supplemental?
Briefly?
When you compared the slides of the communities from Cayley to Okotoks, and it said it was like 13 to 40%, is that 13% of children that you tested had at least one dental cavity? Or can you explain those percentages a bit better to me?
So these reviews, these studies, or screening, we have to send home a note with the child first. Parents give permission for us to come in and screen the children. And so this would be 13% of the children had evidence of decay. So it's not saying the degree of decay, but a child, if he had one decayed surface, would be considered in that group that had decayed teeth.
Okay, and that was active decay, or could it have been a filling?
So it could be a filling, so we use the decayed, missing, filled.
The DMF teeth?
Yes.
Thank you.
So, question, Dr. Musto. On Thursday night, a doctor approached me with a concern regarding fluoridation and the overall effects of poor dental health and effects on the rest of the body, especially in later years. Is there a connection between dental health and overall health effects in later years, or in years, I guess, at all? So I'm just wondering regarding, you are basically saying fluoridation is a benefit, so I'm wondering if that ties in your opinion.
So are you asking if there's a connection between good oral health and overall health?
Yes, that's correct.
Absolutely.
And what is the connection? Could you explain that?
Well, so 2 things. First of all, if you have a good set of teeth, your nutrition is better, you're better able to enjoy a range of foods. If you have dental decay, there is a greater opportunity for other adverse health effects. In fact, you can have the bacteria from your mouth can actually get into your bloodstream and lead to a number of problems. For example, that was an issue in the days when we used to have problems with rheumatic heart valve disease. We used to cover people when they went for their dental work, their cleaning and so on, with antibiotics, because it's quite normal when you go for your dental work that you have the bacteria in your mouth stirred up and they get into your bloodstream, and so those people were at risk of developing rheumatic fever. So on both counts, good oral health is part of good overall health, and that's important for us throughout our lives.
Thank you. Councillor Waldron.
This slide is an active decay. It's not DM. Okay.
My question is, some waters has natural fluoride in it.
Yes.
Has there been any studies where there has been just the natural fluoride in the water?
Yes, that's actually very important in the various epidemiologic studies, because that's actually what raised concerns, particularly for skeletal fluorosis. So fluorosis of the bones, not just the teeth. There are communities in parts of the United States and elsewhere where the natural fluoride levels are 8, 10, so way above what we would recommend. And so there you do see some change in bone at those very high levels. So if where it's natural, at 1 or 0.8, whatever, you have wonderful teeth. Dr. Schwartz just corrected me. The survey in the schools actually is active decay only. So it's not the missing or filled teeth, it's active decay.
And finishing up the last question, we'll take Dr. Sands.
Thank you. Very quick question. The indications on safety, from what I've been reading on some other places, often indicates that, or references folks who are already in poor health, perhaps active kidney disease, and perhaps youth who are infants who are drinking higher concentrations of water, or other folks who are perhaps simply more sensitive to fluoride. Is there studies on safety in that regard? That's the population cohort I'd be kind of worried.
Sure. Again, that's included in those standard setting reviews where they have to set the standards for everybody, and they need to make sure that the most vulnerable are also protected. So that's who they send the standard for. So for those of us who don't have those conditions or otherwise, well, it doesn't even come close to us. But they set the standards to protect those most vulnerable.
Councillor Christophers.
Thank you, Mr. Mayor. So back to this slide then, comparing Okotoks to Cayley. I could look at this slide and say, wow, children in Okotoks have much less decay. Or I could look at this slide and say, wow, the children from Okotoks, their families take them to dentists to make sure they catch the decay. So it's not really a commentary on whether fluoride is it could be, but this slide in and of itself doesn't tell me much. The other thing that I've heard in my research is that often, this is in particular out of a study that was done in Italy in 1999, and they looked at communities that they fluoridated and communities, compared to communities that were unfluoridated, and tried to get a sense of whether or not it was effective. And they indicated that socioeconomic, nutrition levels, and access to dental care and dental hygiene habits were statistically significant, strongly statistically significant in terms of DMFTs. But this could potentially, given that Okotoks is a community that's pretty high standard socioeconomic background, comparing it to rural communities that probably have lower, what we know have lower socioeconomic backgrounds. So someone from Italy might look at this and say you're comparing apples to oranges. So I don't know, do you have a comment on that?
Sure, and that was the point I tried to make with my slide, that first one that showed all the studies with the benefit in favor of fluoridation. It's a multifactorial disease. And the presence of fluoride is not all that you need, but it's an important factor.
Thank you, Dr. Musto. We'll conclude on that. And we'll now go to Dr. Beck for a presentation. And while Dr. Beck is coming forward, I'll just let those people know who may have come in late. This public hearing is only one aspect of the public consultation process on this matter. Tonight's public hearing will be followed up with a survey for Town of Okotoks residents. The survey, which will be posted on the town's website at www.okotoks.ca, will go live tomorrow. Feedback received from our residents will be provided to council for consideration at the council meeting on Monday, April 26th. So that's approximately 1 month from now. All this information will come back, and council is likely at that evening to make a decision on fluoridation in Okotoks water. Dr. Beck, welcome. Floor is yours we went 25 minutes for the presentation, and then we ended up taking close to 10 minutes for the questions.
All right. Thank you.
Up to 25 minutes.
Well, councilors, I know most of you have thoroughly researched this topic and have heard me speak. But for your constituents attending, I will review the science once again. I'm going to read this. This is not my habit, but it's the only way I can control myself and stay within the time limit. So I'll try to make it human, even though I'm reading. I want to assure everyone that the scientific arguments I give are based on reliable epidemiological and laboratory research, not on reviews or pronouncements of organizations or individuals. I have reviewed much of the primary research myself, and I'm confident of my understanding of the issues and of the science. As for my credentials, I'm a physician and a scientist, a biophysicist, an MD and a PhD. I have behind me, and I'm a co-author of a book on fluoridation of 2010, published in 2010. I have behind me 34 years of research experience. And as a disclaimer, I have no material or financial interest in fluoridation. No one's paying me to promote it, and no one's paying me to oppose it. So. Now, in this first slide, this just shows what I will try to go through hurriedly. And the first question is fluoridation effective in preventing cavities? Well, there's no firm basis for concluding that it is. The early studies, often cited by promoters of fluoridation, don't indicate effectiveness and are faulty to the point of uselessness. And I can make detailed points about backing up that statement if you were to question me about it. There are more recent epidemiological studies which show little or no benefit of fluoridation, and the little evidence for very slight benefit, saving 1/6 of one tooth surface out of 128 in the best study, is very likely due to the known delay in eruption, and that is the delay in the developing teeth coming through the gums into the mouth where they're exposed to the causes of cavities. If you delay that process, you delay the onset of any process which might create cavities. And so if you compare children, say, of the same age, some having experienced fluoridation and some not having experienced fluoridation, the children, and this is well documented by dozens of research papers, the children exposed to fluoride will have fewer teeth in the mouth where they can get cavities. On this next slide, this is a more complete presentation of data that I think Dr. Musto referred to. This is where data collected over a period from the 1960s to 2004 from 18 countries. And it shows a diminution over the years in the decayed, missing, and filled teeth, which are taken to represent having had cavities. And this is in 12-year-old children. And the interesting thing about this is of these 18 countries which are having similar experience over these decades, 4 are fluoridated and 14 are not. And it's true a lot of these countries are from Europe, and it's true that in one or two of those countries, salt is made available with fluoride in it, but it's an option, and an option, I'm told, is not taken much advantage of, and it came in later than the beginning of this data. So what we have here is a decrease in cavities in children as after fluoridation was begun back in the 60s. But just because it's a decrease since then doesn't mean it's because of fluoridation. And it seems fairly clear from this data that it's not. So in the next slide, I just want to show you this. Don't bother reading this. It's just show you that I'm not dreaming this up, because it's a very important point. Over and over, I've heard promoters say, if you stop fluoridation, your children's teeth are going to fall out. You're going to have huge numbers of cavities within a year or two. And then occasionally a local dentist is brought forward to say, and this is her personal experience and so on. But we have large studies done, particularly to answer this question. And there are 4 results. Most of them show when you stop fluoridation, there's no change in the incidence of cavity formation. And in some, it shows that the incidence of cavities goes down. And there are 1 or 2 among these dozens that show a slight increase in cavity formation. So the evidence is very strongly suggestive that stopping fluoridation is no threat with respect to dental caries. Now, what is this improvement that we showed in that World Health Organization possibly due to? Well, this can't be proven, but it's certainly suggestive that in the industrialized world during those decades, there's been an improvement in diet, an improvement in professional dental care, and an improvement in education and hygiene. So I think that the answer to the question about the effectiveness of fluoride in the drinking water as a preventive of dental cavities has to be answered with, well, no, it's not effective, or if it is, it's very, very minimally so. Well, it's important then to know that any benefit has to be balanced against risk, and which would bring us to the question of safety. And I want to say about that we, in this slide that I've just put up here, this classifies some, but not all, of the serious abnormalities have been found to be associated with exposure to fluoride and to water treated with hexafluorosilicic acid. Hexafluorosilicic acid, or its sodium salt, is a chemical used in over 90% of fluoridation programs in North America, including Okotoks. Now, these associations have been found in at least 8 human body systems, and which I think they're all listed here: the teeth, the thyroid system, reproductive system in both females and males, the kidney, the brain, intestines, bone, and the cardiovascular system. In some of these systems, now the evidence is quite strongly indicative of a causative connection to fluoride, or chemicals formed when hexafluorosilicic acid is swallowed. In other cases, the evidence is not so strong, but it's certainly worrisome, and it should lead to more research, not to more fluoridation. The variety of body systems is surely affected and possibly affected. It is not surprising when we recognize that fluoride poisons the functions of many enzymes and also distorts the responses of cells to normal chemicals of the body, such as hormones. The function of enzymes, which facilitate chemical reactions, and the function of these cellular responses are critical to the functions of every organ in the body. So one would expect many effects. There are hundreds of scientific publications, peer-reviewed, and incredible journals that give the evidence. Promoters of fluoridation, including medical and dental officers of health in Canada, often deny that there are such publications. I can give you examples of this denial, but on the other hand, I can give you the examples of the scientific publications from around the world that are very suggestive, some strongly suggestive of these various harms. The adverse effect that even the officers of health and the dentists who promote fluoridation admit to is dental fluorosis. Its prevalence in Canada is not known because the collection of data acknowledged by Health Canada is based on small studies in 15 regions, 5 fluoridated and 10 not fluoridated. A very large collection of data, on the other hand, is available from the United States, which is fluoridated to somewhere between 65 and 70%. And it shows that over 30% of the people, including both fluoridated and non-fluoridated regions, have dental fluorosis, and 41% of those between 12 and 15 years of age. Now, some 3 or 4% of those have moderate or severe fluorosis, a very serious and disfiguring condition, and that includes brittleness and cavities. Another condition clearly caused by fluoride and very likely caused by fluoridated tap water is hypothyroidism, a depressed thyroid function. The dose of fluoride a person gets with fluoridation is not controlled. Controlling the concentration in the water doesn't control dose, which is the amount per day, for example, that an individual gets. And this dose will easily, or the amount of water and therefore the dose that a person consumes in a day can easily vary by 20-fold extent or even more, depending on one's activities and occupation, whether they have a particular disease. There are subgroups of the population that drink more water than the average adult. That includes children, diabetics, and people with kidney disease, and other conditions. So we need to consider the effects on all groups in the population, not just the average healthy adult. So hypothyroidism, by the way, is more common in fluoridated than in non-fluoridated regions, and it's increasingly common in North America. In the 1940s and 1950s, fluoride in the form of sodium fluoride was prescribed by doctors to treat hyperthyroidism, to deliberately suppress thyroid function. And that prescription was effective in doing that. Now, there's clear evidence that a certain percentage of the public is acutely sensitive to fluorosilicic acid and or fluoride. And this is it is an apparent toxicity, which is not common, but it's very dramatic. The symptoms are various. It can be skin rash and intestinal dysfunction, fatigue not relieved by sleep or by rest, nausea, headache, abdominal pain, and pain in the joints. And there is little research on this, but some hundreds of cases have been studied by a few physicians. The connection with fluoride in these cases is clear. The patient's symptoms disappear when the exposure to fluoride is stopped. Then, when exposure reoccurs, unknown to the patient, but with their prior given consent, the symptoms reappear. Now, I don't have enough time to discuss all of these possible effects, but I want to mention the evidence that fluoride in drinking water at levels not much above levels used in Canada has caused lower IQ in children. There are now 25 published papers that show this association. There is one paper reporting this lower IQ was not found. In the most carefully done investigation, the high fluoride intake group was found to have IQ 10 points lower than the low fluoride intake group. These studies have been largely ignored in Canada, where the government promotes fluoridation, and no follow-up research has been done here since the appearance of this evidence. Now let me move on to the ethics of fluoridation. And I want to congratulate Dr. Musto. He's the first medical officer of health whom I've heard mutter the word ethics in discussing fluoridation. However, his presentation of it didn't seem to have much to do with medical ethics, which I will get to now. We'll just consider the medical ethics in the context of one thing, and that is the administration of a drug. The canons of medical ethics require that a drug must be administered under supervision of a qualified professional, in this case, a physician or dentist. The recipient must have been informed of the reason for administration of the drug and of the expected benefits and of possible side effects and risks. The recipient must have been informed by a qualified professional and must have been able to question said professional and must have given their consent for taking the drug. The recipient must have the choice of stopping the administration at will. The effects of the drug on the individual must be monitored by a qualified professional, and the information must be shared with the recipient. And the administration must be controlled with respect to dose and safe usage. Now, clearly, the artificial fluoridation of public water supplies does not meet any of these requirements. No one informs us or gets our consent. No one monitors the effects on us. We can't stop it if we don't want it. But clearly, the artificial fluoridation of public water supplies is unacceptable by these standards. But in addition to medical ethics, there are legal and technical matters that we should note. Neither hexafluorosilicic acid nor fluoride are tested for safety or effectiveness as required of a drug. The hexafluorosilicic acid is not a pharmaceutical grade and contains dangerous contaminants. By the way, I should add, Dr. Musto mentioned that the hydrofluorosilicic acid is certified. Well, by the National Science Foundation International. The National Science Foundation International itself says that it doesn't certify without meeting what they call their Standard 60. Their Standard 60 means that they have to have at hand the results of toxicological studies and tests of humans on safety on safety. Now, I think Alberta law, by the way, requires that. But if you ask, and I have a slide here if you want to see it, Stan Hazen of the National Science Foundation says, under oath, that the National Science Foundation has no such studies by which to conclude that it meets Standard 60. So now there are medical matters in addition. One is that the dose is not controlled. I mentioned that there are variation in amounts people drink, and there is a clear fact that particular groups within the population are particularly vulnerable to the various effects of these chemicals, and that difference is, until Dr. Musto just a few minutes ago acknowledged this to some extent, but up until then, as far as I know, it's been ignored. And by the way, I've participated in this discussion in 7 provinces in Canada, and so when I say I haven't heard it before, it may not be global, but it applies pretty much to everything up to this date in Canada. Well, so this variation in response in a population is recognized and expected for any substance and any population. Now, since I've spoken of ethical requisites for the use of a drug, I should caution you that some promoters insist that fluoride, as used in fluoridation, is not a drug. But any substance that is not a nutrient and is administered for a medical purpose, such as treatment or prevention of disease, and dental fluorosis, which is acknowledged by most promoters, is a disease. Any such substance is a drug. And if you aren't satisfied by common sense, then let me tell you that the Supreme Court of Canada ruled in 1957 that fluoride is a drug and it's applied in fluoridation of water and has nothing to do with water potability. And did I say that fluoride is not a nutrient? Well, it's not. It is not necessary for any biochemical or physiological function of the human body. Now, the decision on whether a public water supply should be fluoridated may well be clarified by applying the precautionary principle. The precautionary principle is often oversimplified as saying, if in doubt, then don't. But in reality, it is a matter of balancing the possibility and degree of harm against the possibility and degree of benefit. In the case of fluoridation, in the case of fluoridation, the issues may be listed as shown in this slide. The questions to be answered are, what are the benefits and how probable are they? What are the harms and how probable are they? Are the harms reversible? Are there safe and accessible alternatives for getting the same benefits? With fluoridation, the primary benefit in question is fewer cavities. Secondarily, there is better health and possibly longer life. But as we have seen, the existence of benefit from swallowing fluoride or using water treated with hexafluorosilicic acid is doubtful. If it exists at all, it's minimal. The possible harms are several. Some are very likely, some less clearly, but quite possibly due to fluoridation. And some of these harms are not reversible. Lastly, there are safe and accessible alternatives. One that is likely a big part of the explanation of the decrease in cavities in both countries, fluoridated and not fluoridated, is a good diet with adequate calcium and vitamin D. Also, better educational and dental care, as I mentioned, they're certainly effective. And there are treatments with fluoride available under reasonably safe conditions. And there is fluoridated toothpaste, which is not costly and can be used safely if it's not swallowed. A careful and complete application of the precautionary principle leads to the conclusion that fluoridation is unacceptable. Another decision-making procedure is the plebiscite. Plebiscites have occurred in many cities, sometimes several times in a single city. Usually they result in a close vote, 51 or 2% for fluoridation, 48 or 49% against, or vice versa. And there are maybe a few more percentage points between pro and con. These percentages are usually percentages of 30% or fewer of eligible voters. Calgary had 6 plebiscites. 4 resulted in more voters against fluoridation by a narrow margin, and 2 resulted in more voters for fluoridation by a small margin. Were the voters informed? Not by the information and misinformation that came from both sides. A big difference was that the opponents had no support from governments and taxpayer money and little in resources. And the proponents were the press and the Calgary Regional Health Authority, which before the last plebiscite spent $250,000, and that's in 1998 dollars, of taxpayer.
One more minute.
Okay. So that was the sort of atmosphere that was in which that plebiscite fought. So let me just say that ask the question, how should the voting citizen respond to this plebiscite if they think it is wrong, or if they don't have an opinion on the question of fluoridation? Well, simple, vote no. And if the voter thinks an individual should have the choice of swallowing fluoride and hexafluorosilicic acid or not, then the only way to vote is no, because fluoridating the water gives no one that choice. Given the options for alternatives that I mentioned a moment ago, not fluorinating the water gives everyone that choice. And I hope you'll question me on some of these things so I can add a little information, and in particular about the York review and the NRC review. Thank you.
Thank you, Dr. Beck. Are there any questions of council for Dr. Beck? Councillor Hudson, then Councillor Sands.
Yes, Dr. Beck, I'll ask you the same question I asked of the earlier speaker, and that's the cumulative effects. If I go to my dentist, the dentist applies the top of application. I brush my teeth with a fluoride toothpaste, and I understand both toothpastes are fluoride. And I drink a lot of water. Are you concerned from the
Yes.
cumulative effects?
Yes, for several reasons. One is the use of some of the things that you've mentioned, like fluoride toothpaste. It can be dangerous if it's swallowed, because it varies in concentration of fluoride from something like 1,500 to 3,000 parts per million. And so it's not something you want to swallow. And but it can be safely used. Now, one of the big problems is that we don't have any good following or accumulation estimates of the total amount of fluoride a citizen is taking, whether it's in a fluoridated area or not. Fluoridated water is a principal source of fluoride ingested, but it's not the only source. And in a city, especially a large city where food is processed in the city and drinks are processed in the city, it'll be done with fluoridated water. So in addition to the water you drink, the soda pop you drink, and so on, will have it. And fluoride appears in virtually all the foods we eat as well. The World Health Organization admits, despite its promotion of fluoridation, that should be followed in any community that is thinking about fluoridating its tap water, that being the total amount of exposure. There's very good work on that done in the preparation of the NRC report, the National Research Council report of 2006, which Dr. Musto mentioned, where they did a thorough study to try to determine to what extent a citizen gets fluoride from other sources than the water. And is that's your question? I think the other things like the varnishes and veneers and so on applied by dentists have to be considered, and one has to think about the fact that a varnish will continue, that is impregnated with fluoride, will continue to leach fluoride into the mouth and be swallowed for weeks probably after the application.
Thank you. Further questions for Dr. Beck? Dr. Sands.
Thank you very much. I'm working my way through your book. It's an interesting read indeed. And I've been working my way through Dr. Musto's circulation to us as well. Interesting comment you made, specifically related to hypothyroidism. Consuming fluoridated water may contribute to hypothyroidism.
Yeah.
And you hint it's reversible. If you quit using the fluoridated water, it may reverse.
Yes, yes. The case of affective thyroid is unusual in the extent that it's been well researched. We know the epidemiological evidence But in addition to that, we have a lot of evidence of plausibility. That is, if there's an effect observed in an epidemiological study, it reinforces our judgment about causation if we have, say, laboratory studies which show how it might come about. And we know clearly that fluoride poisons enzymes involved in conversion of the different hormones that the thyroid system uses to control metabolism and the other functions it has in the body.
That's via the enzyme systems.
Well, that's one of the ways. It also seems to have effects on the thyroid gland in other ways. I don't know much about that.
Further questions from council? Seeing no more hands, Councillor Christophers.
Thank you. I don't know how to form this question. I guess that where citizens and where our council gets caught is we have a body of scientists over here showing their research. I find it very compelling and persuasive. Another body of scientists come forward with another sort of opposing point of view that, cites other kinds of science. And often, we get caught in the middle and we don't really know. We're not scientists, we're not experts, we haven't dedicated our careers to examining these. So one of the things that opened my mind, was persuasive, was the number of organizations that increasingly came to an alternative perspective on fluoridation. And I rarely hear about them. In fact, I know of a few. Physicians for the Environment, there's a few, but I thought perhaps maybe you could share some more understanding of the kinds of scientists that are starting to share your point of view, because right now it's just a point of view.
Yeah, well, yes, that's a tough one to answer, because the essential answer is that doesn't matter. But it does matter to people making up their minds, and it matters to counselors. I've seen elsewhere. I think this council, I must congratulate you, is the one that seems to me to have given the most serious and open-minded consideration of the many that I've dealt with. But yes, most of the promoters, I often hear the figure there are 93 organizations in the world that approve of fluoridation of public water supply and so on. But most of those are trade organizations, really, like the dental associations and so on, and they're following the advice of the same people at the top. And that's one of the weaknesses of the reviews and so on. That the reviews, well, for example, the Health Canada review was mentioned by Dr. Musto. The 2010 review released in 2011 was frankly a farce. If you know anything about the literature, especially on harm, you realize what they didn't even mention. And in 2009, the Health Canada asked people in general to read the report and tell them where they've missed anything or come to the wrong conclusion. And some of us did tell them. And they came back word for word without any change. For example, on the 25 studies which were on IQ, which I mentioned, at the time of their last release, I think all 25 or perhaps 23 of them had been published. 5 of them were mentioned, the same 5 in the original draft, and nothing else. It really, and then you say, well, how could that happen? Well, you look at the panel that did the review. There were 6 members, all promoters of fluoride, 4 of them dentists, not scientists. And that's the same thing that you find in most of the panels appointed by governments that promote fluoridation. They pick panels of promoters of fluoridation. They know what the conclusion is going to be. And I've read a lot of reports and reviews. And the 2 best, I think, that have ever been done are the York Review, published in 2000, which Dr. Musto mentioned, and mistakenly represented. I'd like to comment on that. And the 2006 National Research Council meeting, which he says showed considered no other, or found no other harm other than dental fluorosis. That's not true. I hope he hasn't read the report, because if not, I don't know what to conclude. The report was prepared by 12 scientists. Some had been in favor of fluoridation, some against fluoridation, some didn't have a conclusion on it. With the help of dozens of other scientists, they worked on it for 3.5 years, and they published a report of 507 pages with 1,100 references that they studied, and they concluded, as Dr. Musto correctly said, that 4 parts per million is not protective of human health. But they did say that there's definite concern about the IQ studies, definite concern over the studies on hip fracture, no doubt about the thyroid effect, and so on. Those were conclusions in that report. And the York Review was issued in 2000, and it was quoted so often by promoters as saying that it showed that fluoridation of public water supplies is safe and effective, that Professor Trevor Sheldon, who was chair of the committee that oversaw the production of that report from York University, and that was done by a special unit of York University which specialized in such evaluations. He said he felt forced to issue a statement. I have a copy. I wanted to bring it and give it to Dr. Schwartz, because he said in Hinton that the fluoride review showed it was safe and effective, and he told Calgary Council, or commission of the council, several years ago the same thing. What Trevor Sheldon said is that what the York Review panel found that there is not sufficient evidence to say that it is safe, that there is not sufficient evidence to say that it's effective. And in discussing this, one of the things that they found, by the way, they started out with looking at 214 papers, I think. They found only, what was it? Dr. Schwartz might be able to tell me, 20, 24 that were worth studying. And they had 3 grades of quality, A, B, and C, A being the highest. There were nothing in the A category. There were maybe 3 in the B, and the rest were in C. And one of the things they said was the problem with the work in fluoridation was bias. So the York Review has been used over and over by promoters as saying that it's safe and effective. It's not true. And the criticism of the National Research Council report was because it was requested by the Environmental Protection Agency in the United States to evaluate the upper limit, maximum acceptable concentration of 4 parts per million to see whether that was protective of human health. Well, when the report came out, which was gave us a lot to worry about fluoridation, sure, it did conclude that 4 parts per million is not protective of human health, but it's found definite evidence, as I think I said, and Dr. Musto denied, definite evidence to support the conclusion that fluoridation was associated with increased incidence of hip fractures. And they said that the evidence for IQ is very worrisome and requires more study. And they concluded similar things about other toxicities.
Thank you. We'll go to Councillor Hudson. Final question. Just
Dr. Beck, and you mentioned the lowered IQ, and on page 150 of your book, you say there have now been 23 studies from 4 different countries, and you name the countries: Iran, India, Mexico, and China, demonstrating a possible association between fluoride exposure and lowered IQ in the children. I'm going to ask you a question. Like when I turn on my TV these days, and that's not terribly often, but when I turn it on, what has been advocated on one day as a good and positive health benefit, the next day is refuted, and there's some study that's cited. Now, why is it that I should be particularly attentive to a study from Iran, India, Mexico, and China?
Well, the judgment to be made is not based on where they come from. The judgment is based on the design of the study and the reliability of the collection of data. And then the paper will include interpretation of that data and a conclusion about it. But if the paper gives you a fair representation of the data, you can do most of the interpretation yourself, and that's not uncommon to find that there are errors in the interpretation of data in papers. But a scientist who reads it and has the time and takes the care can determine that. The reason many of those papers came from China is because the opportunity to make the study was mostly in China, because China is a huge country. It has areas of very large natural fluoride in their sources of their waters, and you can find pairs of villages which are very closely matched. Sociologically, the families have been there for generations. They have the same occupations, the same age distribution, and so on. But one of them has well water with say 1.9 parts per million fluoride in it, and the other one might have 0.4. And so you can make comparisons. And there are other what we call confounding factors. And you can do certain kinds of analysis to eliminate the effects. For example, lead would be a confounding factor when you're looking at IQ in children. So you do what you can to account for that. And that's why when I mentioned the best study, those confounding factors were controlled for as possible as it could be. And keep in mind, when I give you those parts per million in this village and that village, I'm talking about natural fluoride, calcium fluoride. Calcium fluoride dissociates to much less extent than hexafluorosilicic acid in water. And so you can get the same amount of calcium, of fluoride, just by counting fluoride that you swallow, and it'll be much less effective than the same amount of fluoride from hexafluorosilicic acid. And then there's the fact that hexafluorosilicic acid recombines in the acid environment of the stomach and does all kinds of things that calcium fluoride can't do. So those studies with differences were differences in natural fluoride. So that has to be taken into consideration. And at the time we wrote that book, there were those 23 studies, and there have since been more. Those studies that were available then were relating concentration in the drinking water with IQ. And another study came out with the same relationship with the same two factors. But in addition, a later paper came out that looked at the association of the concentration of fluoride in the blood serum with IQ, which was a step closer. Now we know from other studies that higher concentration in the drinking water is associated with higher concentration in the blood. But at least this study, it adds to those others and in a little stronger way. I think you see what my problem is. You asked me a question, I could go on. I apologize for that.
I can relate, Dr. Beck.
Yes, I definitely can. Dr. Beck, thank you very much for your presentation.
Okay.
At this time, I'd like to thank Dr. Musto and Dr. Beck for their presentations. We really appreciate you coming out on from your busy lives to help inform us in particular. At this time, of course, we're now going to open the public hearing to the public, so to speak.